Thank you, Sarah. Just a note for some of you who are in the back. We have some seats up here for those of you standing if you want to come get a seat. So the past few sessions, we were really looking at the African continent. Now we're going to take a little bit of a regional departure, and we are going to have a conversation with Dr. Balkhy, who's newly appointed regional director for WHO for the Eastern European, to talk about her. Sorry, he's her Mediterranean. Sorry. Thank you. Been a long day with jet lag. And we're going to hear from her 5-year strategy and priorities for the region. And Janila Ravelo will lead that conversation. Jenny.
Well, last year, the WHO member states from the Eastern Mediterranean region made the historic decision, and they elected the first ever, female regional director for the region. So, congratulations, Dr. Balkhy, for your election and eventual appointment. That is quite historic, but I do want to ask you what I know you've been traveling, and you've just started in the role last February. But what opportunities and challenges are you facing as the first female regional director of the region?
Thank you very much, and I think it's still good morning, it's still or good afternoon. Yes. Thank you very much for the congrats. I think it's great to be here with this amazing crowd, and thank you for having me. Yes, indeed, I think it was not expected at the beginning that there would be a female regional director for the Eastern Mediterranean region, but I'm happy that the decision was made. As much as it's, we have to be careful what you wish for sometimes, right? It's a very difficult region when it comes to some of the peculiar challenges that we have. So I started this February 1st, 2024, and I think I was very keen before coming to WHA and mingling with a lot of the partners and member states to make sure that I have a quick look at the significant number of countries, or as much as I can. So I was able to already visit 7 of our member states. And those are Lebanon, Syria, Iran, Pakistan, Afghanistan, and Sudan. And a few others are coming up in the next few months. I think as a female, I can tell you as a female, I still have not felt any specific issues as a regional director. In fact, I think it's been very much welcomed. But I do know as a female professional that it's very difficult to be in a male-dominant society, and there's specific challenges that we all women know about. But I think the world is opening up, and the value of the female talent and skill sets that we definitely have. I'm a mother myself, trying to balance between a career and between my children and my family. And I also come from the Middle East, so we also have huge attachments till very late stages of our life with our parents and with the extended family, and we need to maintain those. So I think those are some of the challenges, but sometimes they're blessings in a way to be a female and to be a mother. I think I would never change that. I would still want to have the children and raise them. But I think the challenges within the region are quite peculiar. So we can talk more about that if you want.
Great, great. Yeah, you're such a superwoman for juggling. I know a lot of women are, but you just mentioned be careful what you wish for. And I know when you assumed the role, the work was pretty much cut out for you. There's so many significant health crises currently happening in the region. There's Gaza, there's Syria, there's Sudan, as just some of the examples. How do all of this impact your plans, your priorities for the region, especially your priority of making healthcare more accessible? So,
Thank you. So I think I was in Geneva for 4.5 years as the ADG for AMR. So the biggest benefit of that is understanding the corridors of WHO and the people and who's doing what and how to identify what needs to be done. But one of the biggest benefits is that, or important issues that I learned, is that WHO is going through a transformation, and that's core to delivery. So knowing who you're dealing with and the dynamics of such a complex organization like WHO, and yet extremely relevant to the member states, is extremely a crucial factor in success in this role. So it's not just about me, it's about what I've learned also, and how do I know to navigate within WHO and with the partners.
Can you give some examples?
Some examples is the transformation. So the member states want a clear impact at country level, and they want the WHO's performance at country level to change in certain ways. So knowing that, I know already what needs to be changed. We need to know what type of skill sets that we need to have in our country offices. How are we going to accelerate the HR processes, the operational and delivery processes that we have on the ground? Very, very operational issues, not technical. So it's a different type of attention that is even more required from regional office, but again, country office. For those in the audience who don't know WHO, we have 3 levels. We have one as HQ, 6 regional offices, each one with a group of countries, and then 152 country offices. The group of countries offices report to the regional director of their region. So that's whenever we say 3 level. So the knowing all of that is going to help in implementing the vision. And you asked me how the complexities within the region. I want to operationalize the work in the regional office with the country office to deliver on the mandate of being the global health leading organization.
Now, Gaza is, very much in the headlines. It's everywhere at the moment. And you've been very outspoken in this. I've been reading your tweets as well about calling for ceasefire and impeded access for aid in the region. What sort of, are there ways that you're still exploring to really get aid in the face of access challenges there?
I think it's very devastating and unfortunate what's happening in Gaza, and just seeing the sheer amount of death that's taking place, with the largest numbers also being among women and children, which is an indication of what kind of escalation is taking place on the occupied Palestinian territories. So I think as a UN organization and as a human, our only way out of the health issues is to have peace today, to have peace yesterday, to have peace 7, 8 months ago, or even before that. So I think it's very important that we speak about that, because the devastation that's happening specifically in Gaza, but also in other countries, is going up, while the humanitarian support is going stable or may potentially be going down. So if we talk about the impact of health on economies, societies, what's happening in the Middle East in several of the countries, and specifically Gaza, as you said, will have a ripple effect. It's already having a devastating effect on the neighboring countries, but it will have devastating effect on the people of Palestine for generations to come. So I think we stayed and served, and we've done that in Afghanistan, we've done that in Sudan, we're doing that in Gaza. Our teams have not left the ground, and I'm very proud of them. Of course, they are way more courageous than me, because they're there, they're serving the people. When we talk about the methods of unimpeded access, Gaza is a special situation. So I'll give a minute to each, to Gaza and then to the rest of the region. I was at Rafah border. I went to Al Arish hospitals, and I visited I visited many and spoke to the patients. There's a huge challenge that we're facing. First of all, the borders are not open easily for the access, and that's a huge challenge. And trying to create innovative ways of delivering, whether it's the maritime or the airdrops, specifically the airdrops had casualties, so that wasn't very successful. And I think what we're calling for is unimpeded land access into Gaza, because we know that's the most efficient. The trucks are lined up in hundreds. So the plea is that we can make that work. I hope that we can make that work sooner rather than later. Although the cleaning of the rebel in Gaza has been estimated to be, will take another 7 years to get rid of the destruction. We need to build. We're ready to come back. The donors are ready to come back and clean up and clean. We just need peace. So That's the access situation that is very specific to Gaza, because there's not a shortage of those who want to donate. The trucks are there, the food is there, it needs to go in. When we talk about the rest of the region, which is also not super easy, I want to emphasize that we have several member states that are under significant sanctions. And the sanctions do, even though they are for political reasons, which I don't necessarily need to discuss here, but they have an impact on the provision of health. And if you allow me to personalize this, because you want to go down
Yes,
to the human level of this. If we look at the sanctions in Syria, for example, when we talk about the lack of energy, the lack of electricity, the lack of ability to provide heat, how does that impact health? The examples that I saw, and I was in Syria, when I was touring and I went to 4 different provinces, Damascus, Hama, Halab, and Homs. And in that visit, I've heard from the authorities that there is more need for burn centers. I'm a pediatrician by training. I was trained in Boston. We had a huge burn center. And I understand what that actually means. But I also understand it's important to know, why are there burn cases? So I wasn't sure, why do they need so many burn centers? What I was told is that because they need to be innovative in providing heat, anything that they can put their hands on is burned, because they need to produce heat, either to cook or to warm the family and the children. So they will burn tires, they will burn clothes, they need to burn plastic, whatever exists. Now, if you've ever smelled a burned tire, you know what it smells like. So you're already contaminating the environment. You're providing heat and energy because of through very innovative, unsafe methodologies. That can cause also burns and accidents. But what's also causing burns is the need to cut off electricity. So the electrical circuits goes on and off intermittently. In the middle of the night, parents might wake up with a spark of a smell of something on fire, and it's because of that cut off circuit. So the impact that some of these issues have when it's looked at, and I understand that it's being looked at from a more political issue, but the impact on the ground is quite significant.
I'm also interested if you can talk about antimicrobial resistance in the region, because before you took on this role, you were Assistant Director General on AMR, which is increasingly getting a lot of attention, especially with the UN high level meeting. How are you addressing that? First of all, what are you seeing in terms of AMR in the region, especially with all of these conflicts happening, and how are you addressing that given the competing health demands?
Thank you. Thank you for bringing that up. Of course, I like that. That's my comfort zone, by the way. So now we go into my comfort zone. So antimicrobial resistance is more of a phenomena. So I like people to think about it like they look at climate change, because you're not talking about a specific disease like HIV, TB. You're talking about a phenomena where these single-celled pathogens want to live. So they're going to do whatever they can to become resistant to the antibiotics that are being produced by humans. So the fact that it is probably the largest silent pandemic that is killing people in the north and in the south, regardless. The member states of the Eastern Mediterranean have really led on antimicrobial resistance. We had in 2022 a ministerial conference in Oman that came out with some really good targets. And in November this year, after the high-level meeting in New York, the Kingdom of Saudi Arabia will be hosting the 4th ministerial conference. So that's at the higher political level. But in visiting my member states, what is devastating is this lack of environmental hygiene is going to create significant burden on the bacteria being and not finding treatments. If we go back to Gaza and we understand that some of the people, if not many, are needing to drink sewage water. They're needing to eat grass. They're needing to live in communities where there's no good sewage system. That is a problem. That's going to elevate the issues. The borders also within the areas of conflict, many of the countries in my region that have poor access to hygiene. So we can expect that the issue of multi-drug resistance will continue to flourish. And we carry these bacteria, whether we know it or not. We are their vehicle to the rest of the world. So it's a big problem, and my member states are keen. They actually are asking me specifically, even though now you're regional director, do not forget your AMR agenda. So I'm very happy, and I'm hoping to prioritize it with them.
The head of Africa CDC, Dr. Kasea, was just here earlier, and he was saying that he was talking to you, and one of the major challenges in EMRO is the migration of health workers. We've heard that as well in the previous panel. Can you talk a little bit about that? How are you working with governments to address that situation, and also why is this happening?
Yes, thank you very much. And I think our previous speaker, she touched on it, and she touched on many areas that I would definitely support what she was saying. But I think there are a few other, maybe I can add to what she said. The drainage is actually happening. Many of it is because of economical issues. They want to go and have a better life. So the environment is not conducive. And we would hope that we would continue to have peace in all of our countries. So that's one thing that would keep our health work talent in our member states, is for them to find the right environment for them to work. Now, when I was in Port Sudan, and by the way, the member states of the Eastern Mediterranean region has significant talent. And many of them are learning a second language in their third or fourth year medical school to be ready to migrate already. So you can imagine how difficult this problem is. And I think that also says that there is amazing, it's not a lack of talent by any stretch of the imagination. But if you have the cream of society who end up going into medicine and other healthcare areas, they need you can't produce a surgeon and tell them, sorry, I don't have an operating room for you, or I don't have the anesthetics, or I don't have the OR nurse, or I don't have sterilization for your equipment. Then how are they going to practice? So they want to do the best of what they can do. So with many of the member states, we are talking about, number one, improving the licensing process so that one healthcare provider can practice in any of the regions. So at least if the brain drain is happening, it's supporting the other regions. And I'm not talking about the high income countries, supporting from Syria to Lebanon, or from Lebanon to Jordan, or from Egypt to Palestine, and so on and so forth. That's one way of how we're looking at it. So improving the unification of the accreditation processes for the health workforce in the region, from the region to the region. That's one way of doing it. Having creative methodologies to engage the health workforce in more intellectual activities like research. And that's something that we can do using the WHO Academy to improve opportunities. So it's not just about the salary. It's about the environment. It's about the health facilities that they need to practice in. And it's about the sanctions, again, going back to the sanctions. So I think we're going to create, for my 3 initiatives, and the member states are all enthusiastic about them, whether it's the access, health workforce, or substance use. We're going to create a platform to identify very clear targets and timelines for how are we going to unblock the bottlenecks of access, health workforce, and how are we going to create national action plans for substance use. The multisectorality in all of this becomes important again. So we will be working on that as well.
There's just so many challenges. I think one last question to wrap up this panel is, what do you do when things get overwhelming?
I speak to my boys. Well, sometimes in the evening, if you want it to be personal, I think it's very important to try to balance a little bit your work life with a bit of a. I'm not a big social butterfly, I have to admit, but I think I'm very passionate about what I do, and I think being overwhelmed is not an option, because I have to dissociate from the dramatic and the very difficult scenarios that are on the ground, and focus on what needs to be done to solve the problem. Because now when you're in this type of a position, there's really no time to get overwhelmed. You need to strategize, divide the work, and get things moving, and make sure that your expectations are reasonable. So not dream too much for the stars, although I know that I do. But I think having that connection with my family really helps.
Thank you so much, Dr. Balkhy, and good luck on all of the work that you're doing.
Thank you for a great interview. Thank you.